So hello, everybody, and thank you for being with us in this Community Chats Extra. So we are continuing to talk about immunizations and why. It's because, there is a lot of people who need to be vaccinated, and some people are pro this, some people are against this. So we're just trying to learn from all of our experts and all the sides to see if this is really something we need to do, maybe not. What are the consequences and side effects and all of that? So today we have a very important guest. So Elizabeth Orlandini, did I say it right? Yeah. Okay. So Elizabeth is from the Rockland Department of Health. And of course, they have a lot to tell us about all the initiatives that they have and what they do in order to help us keep healthy here in Rockland. And also it's Maria Sotos, who they work in the same department, and, they are full of surprises for us because they do a lot in our community for our community. So Elizabeth, Maria, thank you for being here. And I know Elizabeth will be leading this presentation. So thank you so much for all your hard work on this and for accepting this invitation. I'm sure that there is a lot of people who are looking forward to hear everything you have to say.
Glad to hear it. Let me pull my slides up right now.
Thank you. And in the meantime, if you have questions or comments, please put them in the Q&A in the chat box. I'll be happy to read it to Elizabeth. Whenever you're ready, go ahead.
All right. Hi, everyone. My name is Elizabeth, and I am here with my colleague, Maria Soto, representing the Rockland County Health Department. I'm from Immunization Program. Maria is from Communicable Disease. And I'm here today to discuss our services and program activities for vaccine promotion, access, and confidence in the community of Rockland. I'd like to thank Sandra for having me on today. I'm very pleased to be here. So before I start, I just wanted to share a little bit about our basic roles and responsibilities in the community as a program, since I recognize some viewers may not cross paths with us very much in their day-to-day activities. So first and foremost, we offer no-cost immunization clinics for uninsured residents. To support immunization practice among private medical providers in the county, doctors, nurse practitioners, etc. We perform outreach, technical assistance, and quality improvement for physicians and medical offices. And this allows us to form and maintain relationships with private practice in the jurisdiction. It allows us to remain interconnected and prepared for emergencies big and small. And it allows us to further help to ensure access to immunization services for all residents. This includes people who may not meet the eligibility criteria for our health department clinics. And this extends to school health personnel and administration in the county as well. We're also involved at several steps of the process for supporting school health and immunization requirements throughout the school year. On the outreach side, we are tasked with building and maintaining coalitions and partnerships for community health. Our foremost project in this area is a county-wide work group called Vaccinate Rockland that we maintain in partnership with our Division of Health Promotion at the Health Department, which I'll get into later in the talk. And finally, we do direct outreach and education to underserved residents to connect them to health services. So if you're involved in events like food pantries or community fairs or school fairs, you may have seen us tabling and handing out educational materials. So to circle back to our immunization clinics, these run anywhere from 2 to 4 mornings a week, depending on appointment volume. We have sites at the Pomona Health Complex in the main government building, and we also have one in downtown Spring Valley above the WIC office. It's right by the train station and a bus station, centrally located. We see both children and adults at our clinics, and we are part of a wider range of clinical services at the health department available to residents who need them. So this includes family planning, chest services, and sexual health. They are free to Rockland residents, or our clinic is free to Rockland residents who don't have health insurance. And we offer all vaccines that are recommended by the Advisory Committee for Immunization Practice. And if you were on the last vaccine-related community chats, you might remember that the Advisory Committee for Immunization Practice is the federal advisory board that approves and recommends vaccines for us all in the US. So at our clinic, this would include all vaccines that you need for school attendance from kindergarten through 12th grade. We also offer no-cost MMR vaccines to uninsured young adults who need it for college attendance. And in the fall, we periodically run flu vaccine clinics, which are generally announced on the Rockland County government website. Or if you're in the area near our offices, you probably also see them on those big light up announcement boards outside the campus. And here, I might be getting into the weeds a little bit, but I do think it's important to note that the reason why we're able to offer so many immunization clinics at no cost at the health department is because of two programs. So that's Vaccines for Children, which I'll refer to here on out as VFC, and Vaccines for Adults, which again, I'll refer to as VFA. So these are federal and state administered programs that are designed to increase health equity by making sure that lack of health insurance or ability to pay does not pose a barrier to vaccination. And it does also recognize the fact that it benefits everyone in a community when more people get vaccinated. Immunizations recommended by the ACIP are covered by VFC and VFA. And to benefit from these programs, it kind of depends on if you're a child or you're adult, but a person must be uninsured or underinsured, which means that the insurance they have doesn't cover a given vaccine, which is unusual, but still happens. And they must visit a participating provider, is the other point. VFC also covers Medicaid enrolled children and Child Health Plus children. So facilities that participate in the VFC program include the health department, federally qualified health centers, and also, which this is nice, many private practice pediatricians in the area. So the decision to include private practice pediatricians in VFC, it allows eligible children to receive no-cost vaccination with their established doctors in their medical homes. So this also relieves a strain on families to visit a second site just for vaccinations. And all recommended vaccines for children 18 and under are covered by VFC from birth to 18. VFA is a little different. These participating sites are a little narrower, so it includes the health department, us, and our 3 local federally qualified health centers with multiple locations across the county. I would note that the terms of the VFA program are a little more restrictive. It is a newer program and it is a little less robust in terms of funding. So private providers are not included in its participants. However, uninsured and underinsured adults can access hepatitis A and B, Tdap, MMR, HPV, flu, and pneumococcal vaccines at health centers and local health departments for no cost. And now that I've got the clinical stuff out of the way, the clinic stuff out of the way, and the federal program stuff out of the way, I will move into some of our education activities within the Rockland Immunization Program. So this includes outreach immunization coalitions and some grant-funded special projects that we have. So this past winter, the Rockland Health Department partnered with the Jewish Orthodox Women's Medical Association, called JOMA, to bring for families to the Muncie community on Sunday, December 17th. This happens including magazines, newspapers, etc. doctors and other health professionals to educate parents directly on topics, including vaccines for pregnant women, which is very important. But we also had choking prevention, car seat safety, family nutrition, and preventive screening. Lactation and pumping consultants were also available on site to provide support in the moment to new mothers, which was pretty cool. And in making the decision to include a wide range of health topics that are important to parents, we and our partners wanted to situate childhood and maternal immunizations as an important part of routine family and pediatric health practices. So part of the toolkit. Or immunizations, that's us, which offers a range of services, including radon testing. They install smoke detectors, things like that, things that make your home safer to live in. And we were all there to offer education, answer any questions that attendees had, and connect them to services if they needed. JOMA provided wonderful educational materials developed in-house by their members on many of the topics covered. And I would also note that a contributor to the event's success was the food and entertainment provided for the children. So while parents were circulating among the tables, there were games and activities provided for children. So these included like fruit kebab activities. There was a demonstration on growing edible sprouts in a mason jar, which is my personal favorite. And this is important because including activities for children in family events is really critical to increasing accessibility for families. Having elements that engage kids' attention eliminates a childcare need and allows parents to stay longer when they do bring their children. So extra points if they can be made educational, right? Or in align with the event's broader goals. So you have fun activities that keep the kids stimulated and involved, and you teach them about healthy eating, or you keep them moving so that they learn the importance of exercise, things like that. And all involved felt that this event was well attended and received, especially for a pilot. Over 800 people attended the event, which ran for 4 hours on a Sunday, and a lot of positive feedback from both guests and educators. For that, about 70% of audience awareness came from the advertising, but they noted that many guests called friends from the event to encourage them to come. Some left to pick up their children and return, come back to the event, and some even expressed interest in putting the word out to their networks or contributing their own knowledge and services for future iterations. We don't have the resources to allocate to another one at this time, but we can offer similar peer-to-peer education at community events held by schools and other organizations. However, on the whole, the event was a success, and the model holds promise to engage communities of all kinds on issues of family health and vaccination. So really, I have to give a lot of credit here to JOMA as well. They were excellent partners, and they did a wonderful job planning and implementing this event with us. Now, internally, we collaborate with our Division of Health Promotion to maintain the Vaccinate Rockland Coalition. This is a meeting of local stakeholders that convenes virtually on a quarterly basis. This has evolved over time from its original iteration, which was the Vaccinate Spring Valley Work Group. And we expanded it countywide in 2024 to set a wider net for partnership and outreach opportunities. Our member list includes school administrators and health personnel, staff from local nonprofit and advocacy groups, and community leaders. The topics, we really try to keep them centered around vaccine education and uptake, and it includes issues seasonally dependent like school health in the fall for sure, community outreach whenever it happens from us or our partners, and preparedness and response in the case of emergent community health concerns. But we also do our best to include discussions of topics that are salient to coalition members to keep engagement strong. And this coalition was formed with the purpose of sharing information with community partners to help inform their work in community health and promoting health equity. And we also wanted to identify opportunities for partnership and education to increase vaccine confidence and decrease barriers to access for vaccination in Rockland County. It does also serve additional roles of resource sharing among members to help us identify other opportunities to get out there and educate the public. And it gives us, as meeting chairs from the health department, an excellent line of communication to hear from local stakeholders and identify issues that are held in high priority by community members. So we take in this information, and then when appropriate, we use it to help inform our own public-facing activities. And to move further into community outreach, I think it's helpful to share how we converse with people when we go out and do peer-to-peer education. That an educator can turn someone who's appointment in one brief conversation, but there are ways that we go about building trust in vaccines and leaving a positive impression that may bring someone a step closer to softening their views on the vaccine that we discussed. And I think the first step is often the most important one, which is don't assume vaccine hesitancy. People will often surprise you. It's important to start the conversation from a place of positivity and confidence in vaccines as a health professional, and then work from there. If you run up against a concern, then it can be addressed. I would highlight building trust and being receptive to people's concerns as two sides of the same coin. So it's important as health professionals that we don't validate misinformation. But if there's going to be a dialogue, the person you're speaking with needs to feel like they're being heard and understood. And it's important to make it clear that you understand where they're coming from. So once you've done this, you can find a way to include your point. And when you do introduce your point, it should be attentive to the concerns and values of the person you're speaking with. So say you're at we are at a back to school event and you're talking to a parent. It might be a winning strategy to talk about how often kids bring home viruses from school to the whole family. Every parent knows this. So getting flu shots for everyone can really help lighten that load come like November, December. If you're talking to the parent of a toddler who is reticent to be, it is a commitment early in your child's life. You can remind them that the schedule keeps kids protected at the time when they're most vulnerable to vaccine preventable disease. And then talk about the consequences of catching chickenpox or whooping cough in the wild, because again, as health professionals, we know that's really something you want to avoid, and you want to remind parents of young children that there are other ways to prevent really serious disease in your family. And finally, it is important to remind people that despite all of the noise and misinformation on the internet, vaccination is still very much a widespread norm, even if the numbers have been slipping. So nationally, over 90% of children born in 2019 and 2020 got their recommended vaccines for polio, hepatitis B, MMR, and chickenpox on time. And on time is really important there. It's over 90%. And so these are conversations we have as program representatives in a variety of contexts. So if you'll see in the picture there, that is Maria and I and our two wonderful public health corps fellows, Julia and Melissa. We support food pantries at local churches, as I mentioned, and faith organizations like the Salvation Army, where we come and engage clients while they wait with giveaways and education. And we connect them to a clinic if they need, whether it's ours or an external one. We try to maintain a presence at local community events like the Family Resource Center fairs for families in the East Ramapo School District. And most recently, we attended the East Ramapo Spring Fling for families in May. We also attend senior fairs like the one hosted by our state senator, Bill Weber, at RCC every fall. We have gone to speak at senior housing complexes to educate residents about the importance of immunizations like the shingles, RSV, and pneumococcal vaccines for older adults. So we really we want to show that we're out there. And as a division, we are also involved with some local Head Start locations. We're present at some Head Start meetings, and we don't just talk about early childhood immunizations at these, but also the recommended vaccines for pregnant women to protect their babies in the first months of life before they're able to get vaccinated. So by doing this, we don't just catch parents at the point where they might be thinking about expanding their families. We're also able to educate some of the school and daycare staff on these topics, since they're really the ones who spend the most time communicating and building relationships with these families in their service base. And finally, we do media outreach wherever possible. Staff in immunization and disease control have had the opportunity to do brief interviews with News 12 Hudson Valley and a long form interview addressing specific commonly held misconceptions about vaccines on a station called Radio Telemodel, which serves the Haitian community in Rockland. This interview was an hour long and aired twice on the radio station. So we really had the opportunity to get in depth and really break down some common misconceptions about vaccinations. It's important to note that these projects were facilitated by the Parkside Marketing Group, with whom we contracted last year, and they also provided critical support by designing educational materials and managing a social media campaign which placed ads educating about and encouraging on-time childhood vaccination. These were placed in social media feeds that were accessed within specific geographic areas of concern in the county. So we just chose these by data from the state regarding vaccination coverage, and we also chose them based on observed susceptibility to misinformation in selected populations. So that latter insight was gleaned based on conversations with stakeholders in the community and our educational efforts. So here we do really educate about recommended vaccines across the life force from birth to old age. And now, as a pet project, we have been working on a grant from the National Association of City and County Health Officials to build partnerships with faith and community-based organizations. Thus far, we've used this for special projects, which include this Train the Trainer style presentation that you see on the screen, that I've put together with support from our New York State Public Health Corps fellows that are placed with our program. This presentation consists of an overview of vaccine basics, pertinent vaccine regulations, especially for school staff, how to engage with your client base to correct misinformation, and clinics and resources available to refer their clients to if further services are needed. We developed this based on a specific need for vaccine information as it relates to local regulations and their day-to-day service provision to community members. And we were lucky enough to be able to field test it with the staff at the Salvation Army Spring Valley Corps. Our feedback was that the information was helpful, and in the open discussion following the presentation, staff members described feeling more empowered to engage in positive vaccine conversations with their clients. They were more empowered to counter misinformation when they encountered it in their workplaces and connect their clients to care that they needed regarding healthcare and immunizations. Staff also gained knowledge, particularly about the benefits of recommended vaccines for pregnant women and school and daycare vaccine requirements, which allows them to provide guidance to young families who benefit from their services. This is an ongoing project and we are available. I would be thrilled to be able to bring this presentation to any interested faith or community-based organization. Finally, we maintain close relationships with the healthcare providers in Rockland. These partnerships are critical to our ongoing efforts to increase immunization rates and respond to public health concerns and emergencies if and when they arise. Immunization program specifically is a resource for doctors in the county on vaccine-related data management, vaccine ordering, storage and handling support, and quality improvement for immunization workflow and patient education in the office. And immunizations for both children and adults. again, developed for us by the Parkside Marketing Group, which we distribute at doctor's offices and community events. We do have versions translated in Spanish, Yiddish, and Creole to meet the majority needs of our foreign language speaking populations in Rockland. And to date, we have personally distributed a few thousand of these among local medical providers, school health personnel, and community organizations. If your organization would find these useful as well, you can contact the Health Department Immunization Program to arrange a drop-off. And with that, I have come to the end of my presentation. I would like to thank Sandra again for having me on to discuss the work that we do at the program to address the immunization disparities in Rockland County. And I would like to emphasize again that immunization program is a resource for the public on immunization-related concerns. Thank you so much for listening.
Of course, thank you for the presentation. It's really informative, and I'm sure that when people start watching this recording, they're going to be thrilled by all the resources that you have, all those pamphlets and all of that. It's really impressive, all the work that you're doing. And I'm, you know, I have to say thank you because you really support so many different healthcare facilities. Obviously, you support my hospital as well. And yes, we will see you on all those outreach events that we sometimes share. So it's nice to know that we count on the health department for all of those resources. Now, just a few questions before we leave, and thank you so much for that. If you want to get the vaccines, either you're a child or an adult, do you have to make appointments?
At our clinics, do you mean?
Yes.
Yes, we do ask that residents call us to make an appointment.
Okay. And where do we find information about clinic hours?
Clinic hours are posted on the health department website. If you search immunization program, you will see the clinic hours listed on the webpage.
Mm-hmm.
Or again, you can always just call us and we are happy to let you know.
Okay. Maybe, I don't know if you know the phone number by memory, but it might be helpful to repeat that phone number to people so that they know where to call to make an appointment and get vaccinated.
Yes, so I do know the number by heart. We are at 845-364-2520, and the phone number is also in the body of the presentation.
Mm-hmm. Another question. I know that you said during your presentation that due to funding, it's not possible to have one of those health fairs that you did for Jonah. But is there anything in the horizon that can probably bring more of those events to the community? I think they are very, very important for the community. And obviously, you know, I'm sure that a lot of people that work in the community, especially people who are uninsured or underinsured, take advantage of such opportunities.
Yes, so that was grant that we had during COVID, which has now ended, which is why the funding hadn't been renewed for it. We are in talks. I can't make any promises, but we would love to see someone else take that seed of an idea and put it on in their own community.
Mm-hmm. Yes, well, just to let the public know that is watching this video that we have started doing at Montefiore Nyack something similar where we are going to different communities and doing some health screenings. It might not be as big as the Department of Health can do, but you know, it's definitely something that is really good for especially those people that don't have the means or the insurance to go and get screened for different diseases. So it's good to do that. And if we want to partner with you for an event or people want to invite you to events to attend, do they call that same number?
Maria, and we would be happy to help you.
Perfect. Well, thank you so much again for this presentation. It was very informative, as I said before. And now we know here in Rockland County that if we need
Yes.
to reach out exactly to Elizabeth or Maria, please just go to the phone number, grab the phone, and I'm sure that they're always very nice. I have to say that they're always very nice and willing to help everybody in the community. So don't hesitate calling them. Thank you so much.
Yes, thank you for having me.
This is exciting. And as soon as I have the link, I will share with all of you.
Wonderful. Thank you.
Okay, have a good night, everyone. Next week, we don't have community chats, but the following week, we're going to be with you again at our regular time of 12 p.m. So I hope to see you then. Thank you so much.
Bye.
Bye.